Let's go ahead and get started.
Everybody will probably get that pop-up if they didn't
Yeah.
already, but we're good.
Okay. Let me pull up my one last thing on my computer so I know what I am following through on. Here we go. Okay. All right. Hi, guys. It's so nice that everybody's here. Um, I think people will probably still filter in just because we're a little bit early according to my clock, but and I assume it's correct because it's hooked up to the internet. It's probably more accurate than whatever's on my um, stove. So we are here to have one of those kind of hard conversations about making hard decisions in regard to our service dogs. We're going to be talking about things in terms of following through and making those tough calls about retirement, about medical decisions, um, those ones that are like, I apologize, I'm a little bit disoriented at the moment. Okay. So we're talking about the emotional well-being for humans and dogs and making those really tough calls about handler awareness, stressful stuff, and hard decisions about washing your dog, providing a career change, retiring your dog, or if you find yourself in a position where you don't need the dog as much as you used to. Um, and then what to do about our grief when we lose a service dog, because the relationship between a handler and a service dog is different than it is with other types of dogs. And then the fear of not being good enough as a trainer. Many of us come from service dogs into service dogs as owner trainers because of the fact that program dogs are hard to come by. There's far too few of them and they can be very expensive and cost prohibitive. So many of us enter as service dog owner trainers, right? And then there's that guilty feeling and that imposter syndrome in the back of our head that is almost always present. So, on our panel today, we have Penny, who runs Crazy Too Calm, uh, and Amanda Von Tassel, Renee Smith, and Scott Stoffer. If I mispronounced your name, I'm really, really sorry. I blame it on not having enough caffeine. And they're going to talk to us today about their choices, their decisions, both as people who have had service dogs and people who have trained service dogs.
Bonnie
So,
is also on the panel. Bonnie Geyer.
oh, Bonnie, yay!
Yeah.
I'm so glad she's here.
I didn't see her here. Like I was looking for her, but I didn't
Here
see her.
I am. Here I am.
There you are. Yay. Okay, so we are going to kick it off with I wanted to start about, let's go ahead and start with making those hard decisions, such as washing our dog, career changes, retirement, or even if you want to talk about experiences where you entered into a phase of your life where you didn't feel like a service dog was necessary anymore. And so I'm going to go ahead and just have Bonnie kick us off
Yeah,
talking about her experiences in that realm.
sure thing. So, um, I will share my firsthand experience that comes to mind is not directly a service dog, but my dog Bo, that was a therapy dog that we used to visit other people. And as he aged, his chronic respiratory condition. So he, as a puppy, when I got him, he had pneumonia in one of his lungs. And as he was a young dog, that would only flare up occasionally, kind of like seasonal allergies. It's very, like maybe once to twice a year. And then when he got to be probably 7 or 8 or older, it just became a chronic issue. And so that produced a cough, right? And so unfortunately, a lot of the places that we were going into did not care for that or were concerned, that because it sounded kind of nasty that he had some phlegm or different things like that. And so it was really heartbreaking to make that decision for him because he absolutely, his purpose in life was interacting with people and bringing joy to others. But physically, it wasn't necessarily the best for him. So it was kind of that balancing, how do I help him still feel fulfilled while also looking after his physical needs and limitations? And so then it was more visiting family and friends, that kind of thing, rather than putting him in a work scenario.
That's always so tough, especially when it's something that ultimately isn't, you know, catastrophic, but does pull them out of work. And so here we still have a perfectly healthy dog, more or less,
Mhm.
and yet they're not able to continue their process.
Sure.
Uh,
Yeah.
Scott, what about you? Do you have any experiences with this?
Yes, I do. So, not currently, I don't. It's been a few years. My first dog, Elliot, um, was my service dog. But first, I want to say I'm coming from Hickory Apache in southern New Stolen Land, beautiful high desert. And also, happy Pride. Yay. I don't know if
And
anybody
happy
can see it here.
Juneteenth. Well, it seems weird, but it is Juneteenth.
Oh, it is Juneteenth as well.
Yes.
That is pretty awesome. So yes, I do have service dog experience, and I love working with service dogs, owner trained service dogs with somebody's needing help with their dog, PTSD, help mitigate emotional illnesses, mental health stuff. And mine, he did really well because we did he up until older age, and then something happened with seizures. I don't know what happened with the seizures. They just started getting them randomly, so that made me a little bit more wary. Um, so I didn't so I had to really start thinking about it. It takes a while too for, when you start to realize maybe this might, wait a minute, could it? I don't know. Maybe we can go a little, but yeah, well, hold on. You got to step back and accept that maybe it's not time anymore. Or, it's time to start selling. Doesn't mean there's your dog's anything really wrong with your dog, but sometimes it's just realizing that, it's not best for both of you to go in and start looking for other positive, other options for yourself and for your dog, and then some other activities. But thankfully, when he was ready to retire, he was getting older, so I didn't have to focus so much on the seizures. But that was always in the back of my mind, which made working, you know, with him or having him work with me was harder because you don't know. You're always looking for that little sign of possibly a seizure, and it causes more stress on myself. And I end up, you know, accepting I can't deal with the added stress with life. And he was actually quite okay, thankfully, hanging out elsewhere. So yeah, but it was earlier than I wanted to retire him, that I thought he would be for what we were doing. But I mean, he helped me a lot. So and he adjusted a lot better to civilian life than I thought he would. So, that was kind of nice that helps with the burden a little bit. I'm all done.
Awesome. Renee, do you want to tell us a little bit about any of your experiences having to retire, wash, etc., a dog?
Sure. I have two that come to mind. One of them I've never really talked about publicly because it's just so sad. You know how sometimes those go. Um, and she was a wonderful service dog. Her name was Gracie. I loved her. She came with me everywhere I went. She helped me through college. She helped me through my first pregnancy. She was amazing. And then one day at the grocery store, one of those electric carts ran over her and she got real snappy and aggressive. And I didn't handle it well because I was just having a baby and I made her stress worse. And so I ended up having to wash her. And she did not handle the transition very well from being not my service dog. She would have been happier if I had only had her forever. So unfortunately, within about 2 or 3 years of retiring her, she snapped at my kids in the face. And I had to euthanize her because we had 12 other dogs. It just wasn't. So that was a really big swing for me dealing with
Yeah.
that, going from being able to rely on her for everything to losing her. Um, and my other service dog, Charlie, he was wonderful until he got mauled by another dog. And the stress of he has around other dogs was just not worth it at his age to try and do retraining on him. So I had to wash him too.
That's tough. I imagine that's actually a pretty common scenario. I've seen a lot of that where a dog has a very uncomfortable or negative experience and
Mhm.
it leads to them needing to be washed just because the stress becomes too much. Yeah. And that's tough, Renee. I'm so sorry. Amanda, did you want to share with us any of your personal experiences with having to wash, retrain, retire, etc., a service dog?
Sure. So my experience is slightly different. I got Mabel, my dog, as a companion. I had no intentions of training her as a service dog. So I picked for different reasons, right? I loved beagles, I loved their floppy ears. So I went and found myself a beagle cocker spaniel mix. And then I decided that I wanted to be a service dog trainer. I was still about 2 years into dog training life and really interested in combining my passion for improving mental health and dogs. I had trained a therapy dog at this point and decided Mabel and I were going to go through a service dog training program. We discovered two things during that process. She is very touch sensitive. I've been through about 8 different harnesses to try to, and desensitization tactics, of course, to get her comfortable in a harness. And she has still, at 4 years old, not been able to wear one. So that kind of makes it hard to wear anything identifiable to say, hey, I'm out in public with a service dog. So that was a bit difficult. And then being a Beagle Cocker Spaniel, part of her nature is to be very overstimulated in her environment. So she doesn't necessarily do well with food, for sure, and inanimate objects, surprisingly enough. So, like a for sale sign just went up the other day at my neighbor's house. She lost her mind on a walk. Like it was just like, you don't belong here, right? So those things and the laws in the province that I live in Canada say that service dogs in training are only allowed to be in publicly accessible locations. So I had zero opportunity to train in a grocery store, for instance, and I knew that that's where one of my final tests was going to be held. So I had to make the really difficult decision months before it came along. But what's the sense of continuing to slog on through the training when you know you're going to hit that shopping district meat market basically and know that my dog can't handle that yet. And even at 4 years old, we washed 2 years ago almost. And even at 4 years old, that's something that she still struggles with to this day. So I know I made the right call. Um, and it just meant that my journey might take a little bit longer or look a bit different. Yeah.
Yeah. Well, and I think that's a really good note for people to remember that we invest a lot of time and energy and resources, both, in terms of our emotions, our, bandwidth and our finances into these dogs. But there comes a point where we have to look at the situation and analyze it from an analytical perspective. And that can be hard. Just to take yourself out of it and to separate yourself from that sunken cost, you know, and to be like, this isn't a good fit for me and my needs, but it's really not a good fit for my dog. It sounds like you did what was right ultimately for your dog, even if it shortchanged you a little bit.
Yeah. I made
And
her the priority in that case, I think, because I knew how badly she would struggle and then
yeah,
it would affect me emotionally and our relationship at the end of the day too.
yeah. Well, and that's really important is something that I like to stress to service dog handlers whenever I interacting and getting, professionally, especially as the dog's well-being has to kind of supersede your own. And if you're not in a place where you can do that, then a service dog may not be the correct decision at this moment for you. Because, we're asking a lot of them. And so it's only fair that we ask back. For me, I I have retired my first full-fledged service dog when he was about 9 years old. He was a gigantic dog, and at 9 he was just slowing down and feeling the size of his body. And so I had a German Shepherd following that, and she ended up, I had to retire her early, by about a year and a half to 2 years earlier than I thought I would, because she developed DM. She was genetically cleared for it. But they can only test for 2 types of DM and not all 4 types that are known. And she developed DM. And so when I realized that she was slowly losing feeling in her back end, that was a big, tough decision on my part to be like, okay, she's got to retire. I can't ask her to keep working. She wanted to. She desperately wanted to. Um, but it was a really tough transition for her as well as for me to kind of have that gap between her and then my current service dog, Branch, because I realized that she was sick, and it was like, okay, well, we got to find another dog, and then we've got to train another dog. So there was some awkward couple of years there, where I was really kind of in a struggling position, before he was ready to go. So it's a tough call to make. Things that I think are really important in service dog work is that acknowledgement that, like, the dog has to supersede myself, and their needs have to come ahead of my own. And if I'm not in a place where I can do that, then I'm not in a place where I can ethically handle a service dog, is kind of how I look at it. But what would you tell people, would you say is your criteria for, let's take a medical stuff aside, because it sounds like both Renee and Amanda, you've both had experiences where it really wasn't a medical condition, it was a behavioral condition. So what do you tell to people when they question about that? Like, oh, well, is it time to wash a dog? Is it time to, or should I wash my dog for X, Y, and Z reason? Or how could you put so much time and effort and energy into a dog and then just give up, quote unquote, even though we know it's not that simple? What would you tell someone who's struggling in that moment with that decision? Because I can tell you, I think basically anyone who's ever owned or trained a service dog, particularly through the teenage months, um, has had those thoughts, right? Of like, "Oh, is this, I don't know, like, should I wash this dog? Should I not?" So can you guys extrapolate? And then Scott and Penny, you guys can weigh in as well on what you might tell, a client you were working with who was having those kind of doubts about either to reassure them or to help them make that decision from an ethical and moral standpoint. Whoever wants to go first can go. Who wants to go first? Pick on somebody.
I'll go.
Okay, Amanda's gonna go, and then I'm gonna pick on somebody else.
So I really think that from an owner perspective, it's the advice that I would give, I guess, is give yourself a little bit of grace. First, take a step back. Give it, if you're starting to struggle and wonder and question more often than not, I'd say give it a solid 2 weeks, 3 weeks, 4 weeks, a good solid amount of time, and actually track something. Is this occurring as often as I think it is? Is it just me, making assumptions and jumping to conclusions, or is there actual data to go behind the struggle, the thoughts that I'm having right now? And I think if you can track behaviors that you've got concerns with, and over, a solid month, you're dealing with this on a daily basis, and it is impacting how you're able to handle your service dog, or question, do I even want to bring my service dog in this type of situation? Then I think that's really when you have to have that difficult conversation with yourself to do I wash this dog, and what are the next steps after that?
Yeah. What about you, Renee?
So that gray zone between dogs that are fit for service work and not fit for service work is It's so similar to the same questions we ask when we do behavior euthanasias, honestly, right? We're not ending a life, but we're ending a style of relationship. We're ending a whole purpose. So I think a lot of the questions I use come from that, come from learning through that. And I think what I tell people when they're in that area is, are you willing and able and actually confident in your dog? Right? Because if you're not, if you can't say I am comfortable and confident, then you shouldn't be doing it, right? You should take a step back. You should find out what's going on. The other thing I like to say is, if this dog is a danger, whether that's dangerous aggressive or dangerous overexcited and gonna trip somebody, or dangerous because they get too scared and they spook and they run across the parking lot, right? Like, is there an actual danger happening? Because if so, that's an automatic wash. We're done. We don't do safety risks. There's just no reason. That gray zone, though, of when we're trying to decide if it's gonna be a working situation or not, I recommend people step away from their dogs when they come with that decision, right? It's impossible to make that decision with your dog staring at you. When you're looking at your sweet baby that's been there with you through everything, it's impossible to make that choice. You have to leave. You have to step away. You have to be out of the situation and try and imagine, if the answer is yes, what does life look like for 3 days? If the answer is no, what does life look like for 3 days? And see what you can live with. That's my general 2 cents.
That's very good. That's excellent. Oh, Penny, you're up.
I actually have a follow-up question for Renee. And I know we're gonna do questions later, but so you mentioned safety as a huge concern. And one of my like red flags that go up with that, like Renee and I know together we both agree on 99.9% of all things, right? So most of that safety aspect, yes, but there's one area where my mind flags with the safety is, so a lot of times it's a safety risk to the handler as far as, potentially being tripped or pulled out of a chair or that type of thing. So is that something that you would potentially work on short term to see if you can take the safety element, the risk out of it? Or would you just say, no, this dog is going to be way more than you can ever handle and we're not going to try?
I think that depends on the dog, the human, the intensity and the duration of the behaviors, honestly. You know what I mean? Yes,
And also what they've previously tried in the past.
what they've tried, what their learning history is, what tools are we using? Could we try a different leverage system? What could we do to try? And setting a trial window. We are going to try for this long. And at the end of that time, if we're still having issues, if we're 6 weeks down the road and I thought it was going so great, so I thought I would just, and everything goes to shit, everything goes bad. We don't do that. That's okay. You tried. It didn't work. You're not morally wrong for that. Taking the moral piece out of it, it helps answer that safety question too. Like that
That's
question.
exactly what I thought you would answer, and that's what I wanted to hear because I figured other people might be asking it, but not really asking it. So, remind me again what the question was for me because I forgot.
How do we talk to other service dog handlers or clients in particular about that issue of, when do you say enough is enough, or how do you help coach them through addressing that situation of like, okay, this isn't gonna work. Like
So
it's
my
just not.
first, and this could just be because of the training I've recently done that has been discussed in presentations. But anyways, my first is, do you have support? Is it support of other people in your house that can maybe do some of the things you're having a challenge with, like helping to meet that dog's needs, the exercise needs? Do you have support of a trainer who can help you work on teaching you something, whether it's behavioral or management wise? Do you have support of even other service dog handlers that have gone through that process that are willing to talk to you about how they processed it? Because without that support, that's a really tough situation to be in. Like, it's tough for all of us, no matter how great our support system is. But if
Yeah.
you don't have anybody and you're feeling alone and secluded in trying to make that decision alone, it totally overwhelms a person.
Yeah.
So I know my very first service dog, and I don't talk about this one very much either. She was almost fully trained, just kind of exiting adolescence. And we had that lapse in judgment that still happens with adolescence. And she got out into the road and got hit by a car,
Oh,
tragically ripped away from me, right? So at that time, I did not have a support structure. I didn't have plans for another dog. I didn't have, and the emotional aspect of going through all of that. And if anybody's around me, they hear me now preach, use a leash, use a long line, don't do off leash unless you're
yeah.
totally safe, right? But, that's from my dealing with that situation. But, kind of moving forward, like through that, I guess maybe I kind of found my support system, if that makes sense. I
Yeah.
found some other service dog handlers that hadn't necessarily been in the same exact situation I had, but at least could help me walk through it a little bit. And and that's what I think we all need, that specific somebody you can reach out to. So we all know there's a lot of great groups out there. Um, and the one that we talk about heavily is the Crazy to Calm Working Paws group, or it's C2C Working Paws. I know Renee has a great group that works on both sides of the leash. But so to anybody who may be listening to this that feels like they might be in this situation, but don't know what to do, don't do it alone. Reach out to somebody. You know,
Yes.
we have, not that we can offer 100% services for free, but we have groups that are there that are open that can help support you and help you find your support structure that you need.
Yeah.
And with that, I'll let Scott go ahead and share.
Building community. Building community. It's tough, and it's tough in a virtual world to sometimes know where to do that. But yeah, having resources available to help you. And if nothing else, a sounding board to talk to somebody about those things that you're struggling with. Some of it is normal. Teenage dogs are terrible. We're all terrible as teenagers. That's a universal invariant, regardless of your species. And so it can be really tough to be balancing that line between, like, is this just absolute teenage tyrant behavior, or are we looking at a behavior that's going to be forever? And we have a dog who's not going to come through that as a candidate. Scott, what do you have to add? Did we lose him? Oh, there he is.
You're muted still, Scott.
This is 1 second. Okay.
So while we're waiting for
Okay.
Scott, we know he's going to be right here. um, we could kind of just ask if anyone has a quick question on this specific topic or something that they are looking for from the presenters.
Yeah,
It
that's
looks like
always
Scott's
good.
back.
Scott, you're here. Yay.
Yay. No, I'm excited to be here. It's I forget that you can control the mute. I'm not used to doing all these Zoom things.
Yeah.
Um, so it really screws me up. But Penny, go ahead and finish what you were saying because that's important.
Well, I
I
think
did finish. I was just wondering if anybody had any questions, like on this, what the specific question is, in dealing with this. If anyone wants to know anything specific from the presenters, and they can put that in the chat as well.
yeah, the chat feature is wonderful for that. But if not, go ahead, Scott, take us away here.
So yeah, I highly have to echo what Penny was saying. Community, friends, anybody you could talk to. And like Renee says, if you have to take yourself out of it, and then sorry, the other lady that was saying you know do the data, you can assess what you really need to do, but it's always what I always try to do is if I see issues with dogs and I see things a lot differently than understanding what the importance of teenage years are for growth. um, we have to give the dog leeway. We also have to see what's going to happen, but I'm always going to be the one to help the individual. Is this something you want to continue on with? What is, because I don't have in the United States, or in the States, it's not United. In the States, we are pretty privileged by anybody can have a service dog. Doesn't matter what the kind of training they go through. Some states even come from live in California. They allow service dogs in training to go out in public. So we have, because they want it to be as easy for people as possible. So we want to give people as much positive options as they can. Um, and I don't really like using young dogs as service dogs. I do like if that's gonna be your puppy and that's what you want to get. And I'm not against any of that. I'm not. I don't get this wrong. I'm probably gonna say it wrong. But if you want that service dog, I want to come in about 8 months, 9 months, and then continue on for the next couple of years. But we're not going to truly discuss service dog work until about teenage years.
Yep.
Because if we wait a little bit, we're going to start seeing more of the relationship evolve. Where there's going to be breaks in the relationship, because it's the teenage years is to find emotional safety, because they're supposed to be independent and they're not going to be independent, and in fact they're going to be even more reliant on each other. So they're extremely important that they both can trust each other with some animosity. It's going to happen. You're a teenager. I don't like you at sometimes. You don't like me because I'm not letting you go visit your friends or eat that other dog or go for the squirrel. But, and like you were saying, Pine, is this something that's going to last into adulthood that we're not going to be able to get rid of? But I want to know that in the in the States, I am not allowed to know your disability. I cannot ask. I do not ask. But with my own types of disability, you kind of see and things like that. But I make sure it's the dog's going to work for them to the best of their abilities. If we have to talk about it, we are going to sit down, and yes, like Renee says, it'll be you and I, and the dog's probably going to be chewing on a bone outside, or playing somewhere else. And we're going to say, all right, how did you really feel about this? Is this something you really think you can handle between now and, I don't know, so we can get to it the next time? Or, because I can't live with the person, I would love to, but I can't, and they're the ones living with the dog on a daily basis. And if everything else in life going on, is it truly something they can handle? And again, like Penny says, I try to include dog walkers, I try to include doggy daycares, I try to social workers, anybody that's going to try and help, even some of the neighbor kids, if it's possible and it's safe, to come over and hang out and play with the dog in the yard, or somebody else they trust, or grandma, auntie, uncle, somebody, just to get, some of us are just too frustrated to hang out with our dogs. We've overwhelmed, so overstimulated that we look at our dog and go, I can't right now. Legit. Fine. That's totally okay. Because trust me, Blue's ignoring me right now. I get it. But we're going to sit down and have that conversation. And if we're going to really try and figure out if it's something we're going to be able to continue with together. I really don't want people feeling like they have to make the decision alone. And yeah, if there's some sort of, I'll sit there with them. If I can't remember, and I'm not great at remembering on the dot, on the moment, but we have Google. If we have internet, we'll sit there and try and figure out some sort of resources like Penny or Pine or somebody else over here. If it's somebody says, hey, I need a third opinion, or, this might be a better resource because I'm not offering this community support. I'm offering my support, but it might not be the community support you need. You might be a veteran. I'm not a veteran. I've got my own PTSD, but let's look at a decent veteran group for you. Let's see if the VA is doing something. Let's try and open up some of these options where a lot of people are feeling upset, desperate that they can't do this, or they want to push through. Oh, I need to have this. Da, da, da. I understand, but let's see if you're going to go to how do you feel after going to the VA? The VA appointment's late. The bus is late. This is late. This is late. And you have to go home. You barely have time to get your dog to go potty. all these things are late. How are you feeling at the end of the day? And while your dog's waiting for you, do you think you can actually recognize when the dog's trying to tell you your blood pressure's low? Can you recognize when your dog's trying to do deep pressure therapy? Are you going to be able to do some of the stuff when your dog's actually trying to tell you, let alone when they might act out? That's going to be the hard part, or where else are we going to have to find something else for you? So it gives them something else to think about, because a lot of people, when they get a dog, the expectations, oh, we're going to do this and this and this. Service dogs, I need this. It is, medical equipment. So it's like, okay, let's try and what can we actually do? What are your positive options? What are your negative options? So I hope that answered the question.
Yeah.
I didn't get to write it down. I can't find my paper to write it down. So
Well, and
again,
we have a
remembering things on the
really
spot.
interesting question in the chat. Stephanie has asked, does anyone offer any type of temperament testing um, to help clients understand if their dog is suitable for service work before going through training in order to help decrease the amount of dogs who wash out? And Penny responded that Penny offers the Crazy to Calm free online evaluation via Zoom and pre-recorded video, which is a fantastic resource. But also, I was going to say that I believe my presentation goes live on Saturday, is discussing exactly how to choose the right service dog for you, the right dog for you, even to fit in with your lifestyle. And it goes over different criteria that I use in temperament, but also like in straight up just selecting a dog based on physical or, inherent breed characteristics and things like that, and things that I think about. It's definitely not an ABC 1, 2, 3. Here's how you decide, but it's things that I think about when evaluating a service dog. Or a dog for potential service work, on what I want as my criteria and what's rolling around in the back of my brain. And not to brag, I am at a 0% failure rate. So I have never had a dog that I have selected and trained wash. So, but
Well,
I'm,
the crazy, sorry, I didn't mean to interrupt. I thought you were
oh,
done. I was gonna
nope,
say, well, the
no, no.
crazy
I
to
was just
calm
saying I'm
one,
extremely careful about my selection process. That's how I
right.
manage that.
The crazy to calm one is set up as a public access evaluation, but the way it's set up, we can literally walk a puppy of any age through it. Not that we're going to say, yes, they're ready for public access worker to be a service dog, but we can look at that same criteria of like, what is the end goal and which of these are going to be a problem for you as a handler or for this puppy? What are we seeing now? What are we not seeing now? And so we do, like, Belle ran through it for the first time at like 6 months old. That's really when she was just entering training. And so we were able to pull out like the highlights of the things that I knew I needed to focus on during her adolescence. She did it again about 12 months old, mainly as just a recheck. And she's about 20 months old now. So somewhere in the next 4 months, she'll do it for like her final time for now. And we have all of our admin going through it at least once every 2 years with whatever dog they're working in that situation, so that we are making sure that our dogs are staying up on top of it. So it really is that kind of open, available to anyone who's wondering, because it's not a pass or fail type thing. It's a these are our concerns. And so we have two or more canine coaches that will join every Zoom. It can be a live Zoom where you're doing some things we ask you with the dog in that moment, or it can be here's the list of skills we're going to be asking you about. Get videos of what you can for as many of these as possible, and then let's discuss what maybe you couldn't get. So people can do it multiple ways. And I know Bonnie had something she wanted to add.
Yeah, Bonnie.
So I think that's a great strategy for sure, is to have like testing points at multiple points through that development, especially with our younger dogs. Something that like if someone calls me and they're like, how much do you charge for service dog training? That's not even a question that I answer. And I tell them, I say, I start anyone who has that aspiration or that goal, we got to get the basics down first. So that's where we're going to start, because whether your dog develops into a service dog or whether they're a family member, they're going to need to have some solid skills, right? So for me, that's one thing that I do is I tell them like it's a process, that's something we can discuss and we can evaluate as we go through like puppy preschool or that kind of thing, and then we can see what's there, what concerns there might be, whatnot. The other piece that I wanted to touch on was making sure that as a handler or as a trainer that we're also having conversation of what is the plan for the dog if it does wash. So another thing that I see a lot of people do is they say, I got this puppy from the shelter, I got this dog from the shelter, I've had this dog for 2 years, I want it to be my service dog. Or my friend gave me this puppy, I want it to be my service dog. Okay, that's a great goal. We can evaluate, we can discuss that. But, a lot of people out there are not aware of like how special of a dog it takes to be a service dog. And I know Pine's going to, touch on Saturday about how to select and different criteria. But I think we need to be also having that conversation up front with clients about what is the plan for your dog if this goal is not achieved, right? And preparing for that and
Yeah.
letting them know that like even with the service dog organizations that have puppies that are bred specifically for this work, go through 2 years of training, have puppies that wash. And they've been in intensive foster homes. They've been in intensive 40 hours a week of training every week with specialized trained people. Um, and so the idea of a dog washing, I feel like we need to really kind of be upfront with that, and not to discourage but to be realistic. Like, I'll do everything I can to help you towards that goal. I'm going to be honest with you throughout this process, um, but I also want to make sure that we have a solid plan of what happens to your dog, what's that plan at the end if this goal is not achieved.
That is such a good comment. Um, it is all well and good to have a dog that you want to train as a service dog. It is an entirely different prospect to get them there. But then what do you do if you can't? Um, and for a lot of people, if you can only manage economically having one dog, which is the truth for many people, right? I mean, many of us can't afford multiple dogs, especially if you are someone who's living on a really strict income. And so, what do if you have to wash this dog and now you have a dog that you've invested a great deal of time and effort and energy into, and now you have to wash them because they cannot do the job. They just can't do the job. How do you manage that emotionally? And I think that is something that I try to make clear to potential service dog handlers when they contact me that like I can't promise you anything. I've got a really good track record, but I can't promise you anything. And you need to be prepared for what that reality looks like. Does it mean having to rehome the dog? Does it mean you keep the dog and you get a second dog to train up as a service dog? What does that look like for you? And it's going to vary from person to person. And I don't want to shame anyone about rehoming dogs. I don't think rehoming dogs is the worst thing that can happen, especially if it's in the best interest of the dog. If this dog is living in a home that isn't going to be a safe and happy and peaceful place for them, then rehoming them might be the best choice. And particularly if you and the dog are not getting along. And let's be real. Like we don't all get along with every person and every dog we've ever met. That can be happen in the house too, where the human and the dog are just not compatible. No matter how good the dog, quote unquote, the good the dog is or how well behaved they are, they're just not compatible on a personal level. And those are questions that I think are really important to ask going into service dog training, like before you even really get started. Scott, did you have something to add?
Yeah, I was gonna say I saw a sticker the other day. It says, "I like you. I just didn't know I had to do this every day."
Yeah.
So it's
Yeah.
we're not gonna like everything every single time, but yeah, it's very important stuff from both of you.
Yeah. Yeah. It's a really important question. And so that brings me up to some of our other questions that we have. Um, Let me go find my little sheet here that has my cheat sheet guide. There it is. So what else I want to talk about is I'd like to segue that kind of into the grief and the emotional aspect from a human side of what happens when we lose a service dog. When our service dog, even if they've been retired for a couple of years, passes, or even in that moment where we realize that this dog is not going to work and we really need to find them a different place to be in order to continue forward with our journey, or put them into a place where they can be peaceful and happy. So, what do we do about that grief and that experience? Because I will be the first to tell you that there is a tremendous amount of grief around the loss of a service dog that is different from the loss of a dog companion. At least in my experience, it has been. And that there's a lot of grief in that realization that this isn't working and I can't seem to make this work. So, how do you process that grief going forward? And how do you help a handler or a client process that or start those processes of dealing with like, okay, yeah, like my dog is 15 and he has passed, and but this was the dog that I literally trusted my life with. So what do we do going forward? Versus that grief of I tried so hard, I invested so much, and this isn't working and I'm a failure, which I think we can touch upon a little bit later because there's we want to talk about a little bit about imposter syndrome too if we end up having time. So yeah, let's start it off. Scott, you're already up. Let's do it.
Figured it out this time.
Yeah.
So yeah, I haven't had to wash out too many dogs. I do have the loss of mine, which was not great, and it still angers me and bothers me. But one thing I want people to always remember is grief is real and it's natural. We're supposed to feel this pain. We should also try to ask or find a trusted source that can help us process that pain without judgment. That pain means you care. There's also the pain of feeling like you didn't do enough and the grief of the expectations, and that's a little bit different. But with your service dog, it's okay to feel those feelings. If you're upset, dog, who knows the circumstances, if and we're just talking like old age, or it's, you can kind of expect it, but nobody's going to prepare you for the grief that you're going to feel for your dog. Don't let anybody minimize um the grief of your dog. Somebody like you said, Pine, you trusted this, you put your life on the line. Your dog, you trusted this dog to keep you alive. Dog doesn't know that fully sometimes, but that's what it is. They've kept you alive multiple times, through whatever small little tasks or just the relationship or anything else. There's so much that you have all done. Yes, feel those feelings. Those feelings are real. We need, as a culture, we need to get back to feeling that emotional pain.
Yeah.
Do it with your trusted source. Do it and somebody that's not going to judge you. Um, if you wash out, I tell people, if you wash out your dog and it happens, go cry with that dog. Go explain to that dog what all your stuff was, because they don't notice what it is. They'll see you upset and you can have that conversation while you're sitting on the couch with the dog, and then go outside, have a walk. When you're processing with a trusted source, it makes things easier for your brain. That pain's not going to exactly go away, but it helps you knowing you're going through it with somebody else. But yeah, it's if like I said, I've only had to help somebody wash out a couple dogs, meaning private. It was somebody that says, okay, we're not going to be able to do this. All right, I agree. So what do we do now? And their world comes crashing down.
Hmm.
It's not what they expected. And I sit and listen. I ask them if they really want to have this conversation later, now, or do you want to do it later? And sometimes they'll say, no, I'm okay. And I'll wait. I'll lollygag around a little bit while we're doing stuff with the dog. Have the dog come over and do some deep pressure therapy, or have something else that's, something that's going to help the person. And before you know it, they open up like a flood, and we can start process of it. But I want people to understand that it is extremely important to feel this, find a support group, because there's a support group for almost anything now, like Penny says. Pine's got it. If you're here, I can guarantee almost anybody be willing to at least make an appointment, because I know a lot of us are busy, not because you have to pay and all this other stuff. But, people do have, 5 o'clock in the morning is not quite going to work for some people. But maybe 6 o'clock might work, or maybe in a couple days. But yes, they will be there for you. But you're not alone. And that's the other thing I want people to remember. You're not alone. In a culture of a lot of mental health stuff, you're not alone. You do not have to do this alone. And it is not easy to ask for help. And also, if you see somebody hurting, it's okay to ask. So yeah, if I see somebody hurting with their service dog, we'll talk about it. Like the question earlier, it's if they're having those doubts of washing out their dog, and I might not notice till the end of the session because I think everything's going so good. Oh, really? I did not even notice that you were thinking this. Let's discuss this. We want them to know that they're validated. They're real. So I'll stop on that one. Did I answer the question? I forget. I don't have a pen and paper. I lost my pen. I got pen that doesn't have a thing to it, and I lost my paper.
Yeah. Yeah, I mean it's so tough. Go ahead, Renee.
Just to add on to that, I think it's really important that we remember that we are dog trainers, not people therapists. There's a line between I can be here for you, I can be present for you, but I'm not going to give you advice on how to regulate your own nervous system. So I think redirecting them to grief coaches, therapists, that is a helpful thing we can do as a professional in that space. And the other piece is finding some type of consent for them, because a lot of the times, right, we're losing this dog, we don't have a say in it. So there's that revocation of what I say is okay. So getting the control back in some way, shape, or form. Like, okay, we're gonna wash your dog, but that means now you get to do X, Y, Z. We can't condition an emotion, but we can condition an emotional response. And I think we feel the grief, and then we can condition grief to equal something productive if we work with professionals.
Yeah. I think that's a really valid. I mean, it is so important that we acknowledge our feelings. And I think in many ways, as service dog handlers, we experience a different type of grief when we lose a service dog. Even if it's a dog who's been retired. My two that passed, it was compared to the loss of other dogs, other companions. It's a very different relationship. So it's a much more, I feel like in many ways it's a very deep and very important relationship because yeah, I do at certain points in my life, I have trusted that dog to keep me alive. And so to lose them is really hard, but having people in your circle to speak to about that who validate that, who don't invalidate that and say, well, it was a dog, or you have another service dog, which is often the one I hear, like, oh, well, you've got another one. Like, yes, because they're a pair of shoes and they're interchangeable. Um, but having that, and then also, yeah, as trainers, recognizing that a grief support group might be the most appropriate course of action for that human, and that we may be out of our depth where we go beyond being sympathetic and empathetic to that situation to saying like, I can see that you're struggling with something and I don't feel qualified to help you in this scenario because you are in fact not a dog, which is where my area of expertise happens to lie. So let me tell you that I think that this might be a good resource for you. Not that I'm passing you off and I don't want to not talk to you about your grief, but because I think that your grief is deep and struggling, and I want you to get the help and support that you need and are and deserve as a human who has suffered a loss. Royal Mama said that a huge struggle I went through and still have to remind myself is to not compare service dogs. And I think any of us who have had service dogs or that one special dog who was the greatest dog on the planet, even if it wasn't a service dog, I think we've all been there where we're comparing the new dog to the old dog and being like, well, why can't you just be as good as the previous dog. So, something that my husband and partner has told me on many occasions is that, Branch is not Sully and he cannot be Sully. And we have to remember that Branch is only here to fill his shoes and we can't ask him to fill Sully's shoes. And that's something I have to remind myself of even today. Sully has passed away 3 years ago, and I still have to remind myself that Branch is not Sully and he is not going to be Sully. And I need to moderate my expectations from the dog who I hold up on a giant pedestal and bring it down to reality. Like, not that Branch isn't a very good service dog. He's an incredibly effective working dog, but he's not Sully. And every now and again, I have a painful reminder of that when he, does something that's very dog-like. And so that's really important. Yeah, it's important, Royal Mama, to recognize that that comparison isn't healthy for you and it's really not healthy for your dog because it sets them up to fail. Yeah. Go ahead, Bonnie.
So as I've is in my bio, I am a licensed clinical social worker.
Yeah. Well, never
Yeah,
mind. Then you can talk
so
to people.
yeah. So along with that, I haven't completed it myself, but I do know that there are certifications out there for counselors to like a pet loss specialist, basically.
Mhm.
So I just want you folks, I don't have the exact name with me. And I think there's different programs for professionals to go through. But as a professional and as a, whether it's service dog, beloved companion, I don't care what the species is because it's about the bond. So I think a specialist in that can be beneficial
Yeah.
versus just a general counselor or therapist or even just a general grief therapist if you're fortunate enough to have that resource available to you. So I just wanted to let folks know that that is a credential that you can look for or that you can ask about. Um, because not all of us are it's not the specialty of every counselor or therapist to be grief. It doesn't mean that we're not familiar with it and we can't help you with it, but there are folks who do specialize in grief specifically or even pet loss as part of what they offer. So don't be afraid to inquire about that because I think there is a lot of judgment, like Scott was saying, around or minimizing of a loss from people who are not pet people, who are not service dog handlers, that it's just a dog or it's just this or whatnot. And so that can really, to me, create even another sense of validation in how significant of a loss this is. The fact that there's like multiple credentialing opportunities for folks. And it's not just like a 2-hour online training. Like this is extensive in-depth training. So I just wanted to share that with anyone who might find that beneficial.
That is an amazing resource. And I knew there were grief specialists, but I didn't realize that they were branching out into like pet loss grief. Because yeah, I mean, as a lifelong horseman, I have in my lifetime lost horses, and I will tell you that is probably the closest thing I compare to losing a service dog. The relationship that you have with a horse is very, very, very different from a relationship you have with pretty much any other animal outside of my service dogs that I have had to say goodbye to. So it's a very deep grief and it's a very different kind of grief. And I think being able to seek out a specialist if you have the resources to do so is a really good idea. Other, free resources can be like Facebook groups that are, specified around such things so that everyone you're speaking to is on the same page as you are. In terms of like, not coming in there and being like, well, it was just a dog and I lost my such and such,
Mhm.
which was way worse, which is
Mhm.
never helpful for anyone going through grief. And grief is a difficult process. And I think, especially for those of us who utilize service dogs in part to help with our mental health, that puts a whole new strain on the scenario and the relationship when we are suddenly that thing that we are maybe in some ways unfairly dependent upon has to leave. And for many people, it's not as simple as just having another service dog to take up the shoes. If you can only have one dog and at a time for whatever reason, financial or just, housing restrictions or whatever, that can leave you with a gap of situation that can
Sure.
feel incredibly lonely and isolating. So, and if you're not comfortable reaching out to strangers, reach out to your other pet people. I mean, like this, we're dog people. We all
Yeah.
know. We've all been there at one point in our lives or another, making really difficult decisions or experiencing great loss. Because as great as dogs are, they just unfortunately do not live that long compared to our lifespans. And so, make sure you don't have to walk that path alone. And it's real and valid to feel like you've been run over or cut loose from your anchor when your service dog passes. Because it's a deep relationship. Yeah. Penny, did you have something to add?
Well, just that, yes, grief counselors. Scott knows this. Anyone who's listened to the story of his little would know this. But I recently just did my trauma informed certificate, and I'm in the middle of the class to be the pet grief counselor soon, or they call it the pet grief coach to help people process that. And I decided to take that route because there is such that need in the service dog community. Oftentimes people are afraid to mention it or say anything about that grief to other service dog handlers for that feeling of being judged. And it's like we all go, sometimes we have more fingers pointing back at ourselves than we have pointing out at each other. Sometimes we feel like we're being judged even when other people aren't trying to do it. And other times we have like the whole community is looking down on us, it feels like. So, having finding that safe person at least, or that safe place, can be a huge part of processing that grief. But so my bigger picture is judgment is just as real as grief or perceived judgment. Feeling as though you're being judged can really impact that grief cycle. So let's try to just remember that everybody has a different story. Everybody's going through a different place. And let's try to be a little bit better at not reflecting judgment out onto our fellow service dog handlers. I
Yeah.
know the imposter syndrome thing that was kind of on our agenda dives into that judgment a little bit. It's 7 o'clock. I'm not in any hurry, but I did just want to ask, do we want to tackle the last topic? Anybody, or is everybody ready to leave? Because we've been here for an hour. What's opinions? I see a few
Does
thumbs up.
I'm okay to stay, but I'm flexible, so
Okay. I can continue for a little while. I do have a meeting I have to get to in like an hour. But well, by get to I mean transition to a different Zoom call.
Mhm.
Um, I don't leave my house after 5 p.m., y'all, unless I'm going hiking. Um, so and Bonnie, I can see that are you a little bit emotional?
oh, I have allergies.
Okay. Well, because I was gonna say if you're like
Yeah,
feeling some kind of way,
yeah.
like
No,
I
I
get it because
appreciate that very much.
I get sometimes a little
Yeah.
verklempt,
No, I
when I
have
think about
like
it.
some certain things will irritate my eyes just randomly some days.
Yeah.
So, yes. And
Yeah.
Chance is joining us, just so you know.
Aw, look at that boy. So one thing that I would like to say to lead off into our imposter syndrome discussion is I feel that it ties into these questions of washing a dog, retiring a dog for medical reasons, realizing that like this just isn't working or even getting to a point where your health is to a point where you're like, "You know what? Actually, I can do this solo." There comes with a lot of judgment, and I'm going to let everybody know that that judgment that's coming from dog book or dog talk or Dogstagram or all of those places is coming from people who don't know. It's coming from people who've never been in your shoes or don't know what your story is. And so we are our harshest critics, and the vast majority of those people may pass a snarky comment on a Facebook post, and then you vanish from their existence, and they should vanish from yours, in the same tone and regard. So one of the ways that, like, I feel that combating imposter syndrome, and I'm going to be full disclosure, I have imposter syndrome coming out of my ears all the time. I am objectively, by most measurements, considered an expert in my field, and I am constantly questioning myself. So it doesn't go away. But you get to a point where you start to recognize that the voice of imposter syndrome is not necessarily the voice of truth. And that comes back to building a nice, strong community around you of people that you can look at. I'll look at my partner and be like, and he'll just give me the pep talk that I need in that moment. Or, being able to reach out to your friends and be like, what do I suck? You don't suck. And I think a lot of times the judgment that we feel in that imposter syndrome and the judgment that we feel from those snarky comments on the internet, are overinflated in our minds because we're feeling some kind of way. There's so much self consciousness around people who own or train their service dogs. Do I really need one? Am I really good enough? Or am I disabled enough? Which is a question I absolutely hate. I do not ask my clients, how disabled are you? I do not ask my clients, what's wrong with you? I do not ask my clients any of those things. A, because it's sort of illegal, but also because it's rude and invasive. All I need to know is, what do you need this dog to do to help you? What do you think you need this dog to do to help you? And there, we'll go from there. But that feeling of, I'm not disabled enough to have a service dog because I'm functional in, XYZ scenarios. Well, okay, but you're not functional in ABC scenarios. So, like, maybe we should talk about that. That imposter syndrome of, like, well, I tried to train a service dog and he washed out. Well, now I suck. Clearly, I can't train a dog. Like, I've had numerous dogs that I've taken into competition, and we've gotten all the way up to that point and realized that, like, actually, this is not going to work. Like, you hate this. You love it at home, but the second we step into a competition ring, you're just like, absolutely not. This is way too much pressure. I hate everything about this. I've had those conversations with clients. I have one right now who is trained, working with an incredibly athletically gifted golden retriever for agility. He's phenomenal. He crumbles under pressure. He just falls to pieces when he feels too much pressure. And so we're going through that slow process of building him up so that he can at least go to agility class and not just completely fall apart. And she got this dog with full intent of competing at a pretty significant level, and she has made the call, and I fully support it, that he may never get there, but she wants to get him to a point where he can at least enjoy agility practice, and things like that, and doing those things. And he's making strides towards it. We're been working for 6 months now, and 6 months ago she couldn't even take him to practice because he would just flip out. And now he can go to practice, and he can practice for like 5 minutes, and then he falls apart. But we're at 5 minutes, which is huge. So for me personally, I want anyone who feels imposter syndrome to remember that a lot of that is self-inflicted. Almost all of that is self-inflicted, and that mean comments on the internet don't mean anything. And that most of the judgment that you're experiencing is internalized judgment. And it's not that anybody else is giving you that much of their time and energy and effort. Not that because you're not worth anything, but because we all have stuff going on in our own lives. And realistically, it's not something that people, it's just not a thing. Most people don't judge us as harshly as we judge ourselves. And frankly, if you've been on TikTok for more than 5 minutes and seen what those people pass off as professional training, you're doing great, guys. You're doing great. All right. Who wants to take it from there?
I'll kind of
Go ahead, Bonnie.
jump in. So, with the imposter syndrome and it being internalized so much, just like a lot of us as trainers, especially if we're looking at like task oriented kind of things, or we have specialized cases where maybe progress is very slow and, not frequent yet. We encourage our clients to track that. I would encourage you, whether you're a service dog handler, whether you're a trainer, write down your wins for your week or your day. Especially if you're having a really rough week, be mindful and be intentional of noting your successes, and keep one specific journal specifically for that, so that when you have your rough patches, when you have those feelings of, man, all my clients are struggling this week, or man, my dog is just everything we try every day, we're just not getting anywhere. Go back to your wins, because that's going to be what helps carry you through, whether it's the adolescence phase with your dog, whether it's a super hard task that you're training, maybe it's a difficult client personality, maybe it's within yourself. um that journaling, and because that's the reality, right? And it's coming from you yourself, and it's not relying on that external validation, which there is value in that, don't get me wrong. I mean, I benefit from that. But if you don't have very many people, or if you feel like, oh, I'm constantly telling my friends about how I don't feel good enough, or I'm not good at this or that or whatever, that's one way that you can create your own kind of validation system.
So on that, I created a bunch of training, I call them training trackers, and that's something that I put in there is because on one of the little things is where did we succeed? And that's what the training tracker actually tracks. I don't track what needs work because I'm pretty sure any of us who are detailed enough to do that know what needs work, but I can track what's working. And that's really important. And it's so helpful to have that written log because it's very easy in the moment to just be like, everything sucks. I suck. This training session went terrible. And it does. Guys, like I've been training dogs for 20 years, and there are days where I walk out of it and I'm just like, wow, that was just not good today. Either because I'm off my game or my dog is off their game. Somebody's just not, didn't get enough caffeine first thing in the morning, whatever the situation is. And having that physical log to go back and say, actually, at the start, this looked like this, and today it looked like this. So that is progress, whether it's slow, whether it's, not the progress in the area that we wanted it to be. And many times the progress in the areas that where we see progress is where we will see success in other venues, and we can replicate that. We can be like, okay, well, X, Y, and Z is going really, really well, and I'm doing that really, really nicely. How can I take what's happening there and translate it to these behaviors that maybe are more of a struggle? And it's important. It's important to track your progress for your own mental health, but also just so that you can see it in data points of like, oh, yeah, this is actually getting better. Oh, Bonnie, you're muted.
I provide a homework tracking sheet for clients, and one of my sentence starters is, what this is one brilliant thing my dog did today
Oh, it's
to
wonderful. Oh,
help
that's so
keep their
happy.
dog in a positive light. Because we know like how trying and frustrating, especially when we're doing something as specialized as service dog training can
Yep.
get. And so what's one brilliant thing my dog did today?
Yeah. Yeah, it's wonderful. Penny, what about you? How do you battle imposter syndrome?
I could answer you, but Amanda had her finger up.
Oh, go, Amanda, go.
That'd come back to me.
Okay.
That's totally fine. I like the idea of trackers. I do have a training tracker where we, of course, talk about, the things and tick the boxes. But the first question I ask is, what's one thing that went right this week? Find those small wins and celebrate them. So it sounds like that's a super common theme amongst the group of us. And it's because we as humans have a negativity bias. We don't look for the positive. We naturally look for the negative. And it's our own preservation, our own protection measure as humans. So we're geared for all of the things that are going wrong, right? And like you said, Pine, those are the ones that are easy to list off right off the tip of your finger. Is like, oh, XYZ, right? But you have to think long and hard sometimes about those positive and those wins, those moments that should be celebrated. And I find that the one trick that helped me, and this sounds a little bit odd, but I name the little voice that's in the back of your head, that imposter syndrome, right? The you're not good enough. I went through massive imposter syndrome as a dog trainer after Mabel and I dropped out of our service dog training program. That's it. I'm done, right? Like I'm over. I might as well go beg for my old corporate job back and like be in misery for the rest of my freaking life. But what I did was once you start recognizing it as imposter syndrome, give it a silly voice, character, anything. So mine is if Red Foreman from that 70s show, the old nasty dad that's like, you dumbass, right? Like that's
Yeah.
the voice that's in the back of my head. So I gave it a name and I took its power away, or at least some of its power. It's still a struggle some days, but it's so silly, but so is all of the negativity that's in our brains that's trying to convince us of how terrible we are when we're really in fact not, right? We're
Yeah.
all well qualified, many owner trainers in amongst the group. Like we all know what we're doing for the most part, I think.
Yeah. Yeah. I mean, that's a great idea. To give them a name and kind of even turn it into sort of a caricature, right?
Yeah,
That devalues its input because yeah, you're just here for comedic effect.
that's right.
And so yeah, that's really a helpful suggestion. And then being able to distinguish that little negative voice as something separate from yourself and not necessarily a true criticism, and be like, okay, yeah, because sometimes Red Foreman did have valid points about Eric's behavior, but a lot of times he just didn't get it. He just didn't understand. And so you can just be like, dude, you don't get it, old man. Shut up.
That's
And
right.
moving on. And that's really helpful. And we're gonna go down the list because I don't want to keep everybody too late past their bedtime. But Penny, what about you? How do you combat imposter syndrome within yourself?
Well, for me, I think, building on what Amanda said, we're also hardwired to like look to the future, right? Because we all know we can't change the past. So we're always heading for that end goal. We want to get there. We want to get there. So we often forget to stop and think about where we came from. Well, we can't change the past or where we came from. We definitely can learn from that past. And so I'm one that is like, while I'm very, very good at forms, I very much dislike forms. So I hate tracking progress. But especially when you're dealing with something that's challenging, that can be super helpful to know that, all right, so maybe let's take for instance Belle. Belle is my 20-month-old black lab. I like to refer to her as my barking beast because she was barking for attention at 5 weeks old. I knew what I was getting into when I brought her home as a puppy. Her person that had her at 5 weeks old could walk into the room and say, "Hi, Belle, we'll be with you in a minute," and she'd stop barking. But it's that idea of she barks for every little thing, right? So it's very easy for me, say yesterday, when she just seemed to like be growling, not so much barking, but growling, and like that's her whispered communication to me, and now she's squeaking. Well, well, but so she just seemed to be growling at a bunch of little stuff. And for no specific reason, like it's stuff that she finds perfectly normal on most days. But yesterday it bothered her. And so like I'm getting frustrated with it, right? It's like, you're 20 months old. You should be past this right now. How can I help other people with barking issues when I can't get my own dog to stop barking? But in my mind, what I was failing to forget was, yes, we've had like a horribly rainy week. She hasn't got her walks. We haven't been out in public. So she hasn't gotten her work. We haven't even done any like what I consider training sessions. Yes, we're training all the time, but we haven't, like, for me, a training session is usually set up the camera, do something intentional with trying to work on a specific behavior or two or three or whatever it is, but it's intentional, not
Yeah.
the unintentional training I do all day long. But so reminding people that we all have those days. So if it is just one of those days, Throw your training plan out the window that day and just love on your dog. Do something enriching, do something, that both you and your dog love together. I think it was Dr. Holly Ted, who's going to be with us tomorrow, that had said, make a list of the three things you love and three things your dog loves. Now make a list of three things they love to do together. So that you love to do together. So when you're having that bad day, just pick one of those things on your list and do it. Right? And if you need time away from your dog, you pick something from your list, something that you love to do. And if you need time with your dog, pick something from the list that you love to do together. And if you just need your dog to be quiet so you can get something accomplished, pick something that they love to do that's on their list that you can give them to do while you're finishing XYZ. So, naturalizing that and letting people realize that we all have those days. Let's get past it. Let's look, if those days are lasting too many in a row, let's look at what is building up to that and what's the root problem. And can we address that in a future training plan? Maybe not today while we're emotional about it, but can we make a plan for how we can improve it in the future? Instead of focusing on, I want to hit that end goal now.
Yeah. Oh, I love that. Because yeah, that's something I think especially as a trainer, I'm incredibly, and it, particularly with service dogs, we're all very goal oriented, right? We're trying to get this dog to a point that they can actually do the job. And it's very easy to lose track of all the things that are going very, very well, in the moment or in this process because the goal has not been achieved yet. And I am as guilty as anyone of being like the goal must be achieved by, you know, and that's unrealistic and not fair. And that's part of my upbringing and my personality is just to be like, let's drive forward and we can't stop until we reach our goals. And that's not always productive. And it definitely makes my imposter syndrome worse when I'm not meeting expectations that, by the way, the only person who has set is me. Um, that I think is one of the things that fuels imposter syndrome more than anything is those unrealistic expectations that we set for ourselves that we would never set for anyone else in our lives. We would absolutely never do that. Oh, Renee, you've got to go. I was just going to ask you to chime in. Can you chime in for just a second and say how you fight imposter syndrome within
Mm,
yourself?
Yeah, I can talk for just a second. If my kids interrupt, just know it's because their timer went off and they are ready.
Yes.
The life of a single mom never ends. Um, so what I was going to say about imposter syndrome was it can be really helpful to coach people where to look for the wins, right? I feel like a lot of times when somebody asks me, what was your win of the week? I forget everything that I just talked, like the whole week disappears immediately. It's immediately the wrong answer. So coaching people, I like to tell them to look at the end of the loop for progress. So do we see a decrease of intensity, a decrease of duration every 3 to 5 days? If the answer to that question is yes, you're doing something right. Move on with your day. Move on with your life. You're doing something right. Every 3 to 5 days, as long as you're seeing a decrease of intensity and duration. So that helps me kind of get through those moments. And on the human side of it, remembering that a lot of times the antidote to imposter syndrome is not more confidence, it's more self-trust. Those are two very different things. And I think a lot of the times they get merged and conflated, but moving towards a self-trust that I trust that when I try something new, my brain's going to tell me I'm going to fail. I trust that. That's gonna happen. But after that, I'm going to do XYZ. You know what I mean? Moving into that trust space more than the confidence, that really helped me.
Oh. Renee, you are wise.
It
I
was
would
so great to
listen.
be here.
Yeah, I would absolutely listen to you talk about like things like that because that's fascinating. That's a fascinating perception and a take on a situation, that idea of trusting yourself versus necessarily having confidence in yourself, because yeah, those are two different things when you really think about it. Renee, it was
Yeah.
lovely so much to meet you, and I hope we run, I'm sure we'll run into each other again, and I'm sure everybody on this panel has just really appreciated your input. So I will let you get back to your children,
Bye,
and we're going to pick
everybody.
on Scott next.
Thank you. Bye.
Thanks. Bye.
Just while he's unmuting, go ahead and unmute Scott. But I just wanted to say, for those of you that have the workbook for the symposium, And if you don't have it, it's readily available. But for those of you that have it, there's links to all of these for all of our presenters. So Renee's Human End of the Leash Facebook group is linked in the workbook. Um, my my support groups are in the workbook. Pine's website and information. So everyone who is here as a presenter, you can reach out to them through those links in the workbook. So if you don't have it, let me know. We'll make sure you get it.
Yeah. Yeah, and we do like being bothered. Just as a general rule, I love it when people comment on my social media stuff and ask me especially thought-provoking questions. It's always fun for me to just be like, "Oh, how would I handle that?" All right, Scott, take it away.
All right, so I want to, Amanda, you're Red Foreman. I hate you right now because every time I make a mistake, I go, dumbass. So it's like
Yeah.
anytime I'm with I'll say that to myself and it makes me laugh. Of all the things I've ever watched all my life, that's one of my biggest influences. Um, so I grew up with a very judgmental family, loved, but very judgmental, and trying to make me an adult before I was ready, never taking care of my own needs. But before I get into that, I found something this weekend in a local town. I don't know if I can show it, how well it's going to show, so I'll read it. It's called a pocket hug, and somebody made this. And I different animals, they laser cut different animals, and they put a little banner on it that says "You are enough." So I'll try and
Oh,
I
that's
can't
so
even see.
cute.
Can you see it?
I saw it briefly, and then the computer was just like, "Nope."
Yeah, all I see is, oh, there we go. I'll say all I
There
see is
we
a hole where it's supposed to be at.
Yeah, oh my
So
gosh, how
and it's
cute.
small. It's for your pocket, right? The little Levi fifth pocket thing. But it comes with this little thing, and there's a pocket hug, and there's different little sayings that says, "Sometimes you forget how awesome you are. This pocket hug is a gentle reminder." So it's one of those things. If you have it on you, you know, you can hold it and go, "Oh, that's one of the I am enough." Not that we fully believe it all the time, but sometimes the visuals and um. But one thing I talk with my clients about is when they're I don't if I have imposter syndrome, I don't acknowledge it. I acknowledge my mistakes. I acknowledge when something's messed up or it's not going right, because I'm more focused on what the dog's going to be doing next to make sure we're all going to be safe and things like that in the environment. Um, but what I always do with people with service dogs, I let them know this is what the ADA says, and it's almost stayed this way since 1990. It was created for you. It was not created for somebody without a disability. So nobody gets to tell you how you get to have your service dog. And unfortunately, we are going to run into those. But this is created for you. If you don't want to hire me, you still get to have this dog the way you train it. But so it gives you a little bit of power. But yeah, and when we talk about days that go wrong, I am a smartass, and I tell people do your best to be a smartass, because if you can take that and be frustrated, or you feel frustration in yourself, don't hold that. You can gently explode. Like if you're mad, don't take it on your dog, but you can use that to be a smartass because you're playful, but you're also defensive. So if your dog does jump too much, you can counter that, and you can still, your brain subcortically is helping you defend yourself. You're not mad, so you're going to push your dog away and all these other things, but you can be a smart, and you can start saying, "Thanks, dumbass. Thank you, Amanda. I haven't made a mistake in a while, so that was a good reminder." Just kidding. But I actually haven't used that voice in a while. I missed that voice. Huh.
It's a great.
But when you start, like I tell people, if you can, like, mistakes are important. It's how we learn. We don't have to dwell on it. No, the best thing we can is not dwell on it. But yeah, if you have to discuss it, or you get mad, if you feel yourself getting mad, feel it. Go do some, burn it. That's energy. Don't hold it, burn it, use it. And then come back, and now maybe you need a rest. What's going to happen next with you? We can discuss it. We can play it off. In the meantime, I'm going to make sure your dog, and I'm going to show you, look, your dog's actually sitting next to you, waiting for you to pay attention. So whatever you're doing, your dog, while you're having these emotions, your dog's here for you. Your dog is
Yeah.
right there next to you, waiting for you to acknowledge them. sit with them, and they'll fight it. When you're mad, you don't want to do it. And then they sit and rest with their dog and they go, thanks, I feel better. I'm like, haha, I didn't have to do it. And then I get to be the smart and all this other stuff. But I try to remind people the best they can that it's, as a guy, I don't think I have to worry about imposter syndrome so much unless I'm going up against somebody with a PhD and we're going to talk about neuroscience or effective neuroscience. I know there's going to be things I'm going to screw up on, but I also understand that even with the mistakes that I'll make because I'm nervous or whatever else, the brain automatically uses that for you. Like we're supposed to make mistakes. Not everything's supposed to be perfect. So if I trip on a brick, guaranteed I'm looking back to go, I did not know that was there. I do now. My dog jumps on me because I misplaced my treat. Yep, I remember that. Don't put my treat up there. And these things we can help. And then also when we're teaching, we're helping the other people do it. And like everybody else has already said, when you're upset or you're having a bad day, call yourself a dumbass and move on. Red doesn't dwell on it. The next episode is something different. It's going to happen. None of us, there's not a single perfect dog trainer, no matter what everybody tries to show you with every single thing. We are going to help you to the best that we all can. Have that community. It's never not enough to have the community. It is hard to ask for help, and especially if we have a comparison. I know, Pine, you do this constantly. That comparison with the other dog, and you look at your new dog and you go, and then you look at your husband, he goes, hold on. You're like, you're right. I almost did it. Almost did it. And then you get back, like Penny says, back in the present moment. You have that quick little support, or even if he comes over, he sounds like a very subtle kind of person, not so like dramatic, but he'll like, I'm sure he comes over to you and you're like, oh, what did I do? Oh, I see it. He lets you self-actualize, self-realize it and go, okay,
Yeah.
you're right, but
Yeah.
not judge you
Yeah.
for it.
No.
That's
Yes.
great. I love that for you. That's it's
It's
so
healthy
supportive when you know somebody's
communication.
gonna, oh yeah, and he's reading you and that small little community there, even if
Yep.
it's just you three forever.
Yep.
Um, but yeah, I try to always remind people that, because I could tell you you're enough. I could tell you don't worry about it. But if you don't feel it, it's gonna be hard.
Yep.
Um, but I try to show them little things while they're upset, like how the dog's kind of coming over to them, or the dog's sitting across the room waiting for them to hang out. And they're like, my dog doesn't want to be with me. I'm like, your dog is directly across from you, across the room, standing very dramatically, hoping that you'll eventually make eye contact with them, but you're avoiding eye contact because you know they want connection. You don't want to give it right now, do you? Well, yeah. Well, just sit down and watch your dog come over to you. Or, kneel down, take that breath. 'Cause, you can start to see when people are starting to relax out of it. And I don't let them stay in that moment for too long when they start petting their dog. And if they stop, you're like, hold on, your dog says it's not enough. You got to keep petting. Hold on. And then a couple minutes, how are you feeling? Oh, a little better. Can we continue on? Uh, yeah, we could do a little bit more, but I don't think we're going to do what we did. We'll absolutely come back next week or next time and do it again. Um, yeah, I think it might have been a little too much for you, or maybe the dog will, but let's try and do this something slightly different and see if we can get it in there on accident. So
An
yeah, it's
accident.
just the emotions are important. Negative
Yeah.
are still negatives to get you back to being social, the way I see it. It's
Yeah.
self-defensive. We're all born with it. Every single creature has them, or every single mammal has the positive and negative, social, non-social, so we can get back to being more social, so we can actually recover. And why would Mother Nature have it? Why do I have
Yep.
to get mad?
I think uh I think it's a good idea that, maybe the next time any of us are feeling that imposter syndrome or that sense of, well, I suck today, or my dog sucks today, or I'm never going to get this, we're never going to get this, it's never going to happen. Maybe we should just ask ourselves, is this a Red Foreman thought?
Or
Is
what's that other one that's from, I think it's the Water Boy, where I think
yeah.
it's Rob Snyder's character goes, "You suck."
Yeah, yeah, exactly. Is
Something
this
that
a
can
Red
make you
Foreman
go,
thought,
yeah,
or is this this objective truth. Do I suck? No, I don't suck. I just,
But
in
like
this moment, am not living up to whatever expectation I have set for myself. And maybe
and
that
Amanda says,
expectation,
yeah, sorry. And like Amanda says, once you name it or put you own it to the best of your ability, it loses power.
yeah. Especially
So
if we're, framing it in the sense of a caricature of something, it's not a serious thing. We don't have to take it seriously when it's Red Foreman from a sitcom. We don't have to take that seriously. We don't have to process that seriously. Like it's a Red Foreman thought. Buzz off moving forward. But, and things like that. Well, I think with that, it's now 6:34. We should probably let these poor people go. I hope that they feel like this has been useful or helped you guys kind of process some stuff that maybe you've internalized or haven't really thought about, but maybe needed to think about, or just, kind of give you some advantage points to moving forward with your own journeys as trainers, as service dog handlers, etc. I know that I have felt that I'm in very good company with our presenters, and if you get a chance, go through that workbook and go like everybody's Facebook page and their Instagram and whatever. It's a little positive reinforcement for your dog trainer. It's helpful for them. It's good for their business. It's good for the algorithm and everything else. And this conversation, this panel will be available for people to watch later on. Penny's going to make sure that, anybody who missed it or had to leave early can catch the tail end of it. But I think we had some really good talks here today, guys, and the questions in the chat and the conversations in the chat that were happening. They weren't huge, but it was really neat to see people interacting and, offering their own suggestions and their own experiences and commenting on the things that have impacted their life as well. So I think the big takeaway from this is, from this last little section is just, ask yourself, is that a Red Foreman thought?
Perfect. And I mean, I did want to just say that I'm trying to find the link right now for the Working Pause group where this discussion can continue if anybody wants to. Um, but yeah, reach out to us. We're here. Don't let yourself sit there and wonder. If you have any additional questions, feel free to email them to crazy to calm k9coaches at gmail.com. And if you're struggling with anything in this conference, that's where you would send the email just to say, hey, I need help with XYZ, whatever that may be, as far as like getting the daily emails or whatever that may be. Other than that, I look forward to seeing everybody back tomorrow.
Yeah, that was awesome, guys. Thank you so much.
thank you.
I just found the link. So I'll pop
Oh,
it in the
yeah.
chat quickly for anyone who's here. If you're not a part of that group, it's a free Facebook group to join. You can ask additional questions there. All of the presenters that were here tonight are in that Facebook group as well, so you can reach out to all of us there.
Okay,
Everybody
guys.
have a good night.
Yeah, I'm going to peace out and try to take a moment before I have to go to my next meeting.
Bye, all.
Bye.